Dear friends, brothers, sisters, and beloved viewers of the channel Living Healthy with Van Van. I am a doctor, now over 50 years old, with more than 30 years of experience walking alongside my patients. Over the years, I have encountered countless cases of headaches. Some describe them as pounding like a hammer, others as a dull ache lasting all day. But one of the most common types my patients suffer from is tension headache. At first glance, many people think it's just a minor issue. But in reality, it silently steals away our quality of life, our sleep, our work, even our daily mood. And if it persists, it can lead to dangerous consequences. Today, I invite you to join me in exploring: what are tension headaches and migraines? What causes them? How can we recognize them? And most importantly, how can we help ourselves break free from the vicious cycle of pain? What is a tension headache? Tension-type headache is the most common form of headache today. Unlike migraine, which often comes in sudden, severe attacks, tension headache is dull, persistent, and widespread, like a tight band squeezing around the head. Many patients have told me, "Doctor, it feels like I'm wearing a hat that's 2 sizes too small." Another said, "It's like someone is pressing my temples with their hands, not stabbing pain, but a constant, heavy discomfort." Tension headaches often last for hours, sometimes days. They are rarely unbearable, but what makes them troubling is their persistence, making it hard to concentrate on work or enjoy life. Who is most at risk? Sadly, anyone can develop tension headaches. But from my clinical experience, 3 groups are most affected: young adults, especially office workers, spending long hours at a computer under high work pressure; middle-aged and older adults, burdened by family, financial responsibilities, or health worries; women, more sensitive to stress, more prone to sleep disturbances, which then trigger headaches. I recall a 32-year-old accountant. She worked more than 10 hours a day at the computer. She came to me saying, "Doctor, I wake up with a heavy head, go to bed with buzzing in my ears, and can never sleep peacefully." A typical case of tension headache. Underlying causes. The main problem usually isn't brain damage, but rather, muscle tension in the head, neck, and shoulders from sitting too long or poor posture. Psychological stress. Prolonged worry or sadness disrupts brain chemistry. Sleep disturbances. One sleepless night almost guarantees a headache the next day. Unhealthy habits. Too much coffee, alcohol, skipping meals, or dehydration. In short, tension headache is the result of a combination: a tired body plus mental stress plus poor sleep. Typical symptoms. To distinguish tension headaches from others, remember: dull, band-like pain around the head. Lasts hours or even a full day. Often accompanied by stiff neck and shoulder muscles. Rarely involves nausea, light sensitivity, or sound sensitivity. That's migraine. Worse at the end of a long, tiring day. When to be cautious? Though usually harmless, tension headaches require medical attention if sudden, severe pain like a thunderclap. Accompanied by weakness, facial droop, slurred speech, possible stroke. With fever, stiff neck, and vomiting, possible meningitis. Persisting for weeks without improvement. In these cases, don't dismiss it as just stress. Seek medical help immediately. Impact on daily life. Tension headaches rarely threaten life, but they do erode quality of life. Poor focus at work. Irritability, impatience with loved ones. Disturbed sleep, waking up tired. Chronic cases may lead to anxiety or depression. One of my patients, a teacher over 50, told me, "Every time I step into class, my head feels so heavy. When a student asks a question, I need a few seconds to think before answering." From loving my job, I gradually grew afraid of teaching, afraid of speaking. This is the dark side of what seems like a harmless condition. Diagnosis. Usually, diagnosis relies on symptoms and a physical exam. Most cases don't require complex scans. But to rule out serious conditions, doctors may order MRI or CT brain scan. Blood tests. Blood pressure and heart checkups. The key is distinguishing tension headache from more dangerous causes. Medical treatment. Treatment options include over-the-counter painkillers like paracetamol, ibuprofen, short-term use only. Muscle relaxants for neck and shoulder stiffness. Low-dose antidepressants in chronic cases with anxiety. Physical therapy, acupuncture, massage to relax muscles. Important: avoid overusing painkillers, as this can trigger rebound headaches, worse than the original pain. Lifestyle, the true key. Most of my patients improved significantly simply by changing their lifestyle. Sleep well, go to bed early, aim for deep rest. Gentle exercise, walking, yoga, tai chi to ease muscle tension. Relaxation, music, meditation, deep breathing. Healthy diet, drink enough water, eat vegetables, limit coffee and alcohol. Stress management, learn to say no, share burdens with loved ones. Simple home exercises. Here are a few easy practices you can try right now. Slow neck rotations, left, right, forward, backward. Hold each for 5 seconds. Temple and neck massage. Gentle circular motions with fingertips. Deep breathing. Inhale slowly through the nose, hold 3 seconds, exhale gently through the mouth, repeat 10 times. These small habits, practiced daily, help relax muscles and lower headache risk. A little philosophy about pain. A patient once asked me, "Doctor, why do I always get tension headaches, while others in my office don't?" I smiled and said, "Maybe your body is reminding you, slow down, live more gently." Pain isn't always disease, it can be a signal of imbalance. Indeed, tension headache can be the body's gentle reminder to return to self-care. Migraine, the storm in the brain. Another patient once told me, "Doctor, when I get a migraine, I just want to hide in a dark room. Even the slightest sound or light makes me feel like my head will explode." Migraine is not just pain, it's a neurological storm that can destroy quality of life, work, and even family happiness. So let's also explore migraine, what it is, what causes it, its symptoms, and how to fight this silent thief. What is migraine? Migraine is a chronic neurological disorder, marked by intense, throbbing headaches, usually on one side of the head. Unlike tension headaches, migraines are severe, pulsating, and often come with nausea, light and sound sensitivity. Attacks can last hours to days, leaving sufferers exhausted. The word, migraine, dates back to ancient Greece, from hemicrania, half the head. Today, it remains one of the leading causes of chronic headaches worldwide. Who is prone to migraines? About 12% of the world's population suffers from migraines. In Vietnam, the rate is also significant. Higher risk groups include women, 3 times more likely than men, especially ages 20 to 40, linked to hormonal changes. Family history. Risk is 2 to 3 times higher if parents have migraines. Those under chronic stress or sleep deprivation. People sensitive to light, sound, or weather changes. I recall a 38-year-old lawyer. Around her menstrual period, she would suffer unbearable migraines, sometimes missing important trials. A classic case of hormonal-triggered migraine. Causes of migraine. Though not fully understood, key factors include neurotransmitter imbalance, especially serotonin, affecting brain blood vessels. Genetics. Strong family tendency. Environmental triggers. Weather shifts, strong smells, bright lights, noise. Lifestyle. Lack of sleep, skipping meals, alcohol, caffeine. Hormones. Worsens during menstruation or menopause. Think of a migraine brain as an oversensitive alarm system. Even small stimuli trigger a full-blown attack. Typical symptoms. Intense, throbbing pain on one side of the head. Nausea, vomiting. Sensitivity to light and sound. Blurred or flashing vision. Worsens with movement, coughing, or exertion. Some experience aura, flashing lights or tingling before the pain hits, a warning signal. Phases of a migraine attack. A classic migraine has 4 stages: prodrome, fatigue, irritability, food cravings, yawning hours to a day before pain. Aura. Visual or sensory disturbances, 20 to 30% of patients. Attack. Throbbing pain, nausea, light sensitivity lasting 4 to 72 hours. Postdrome. Exhaustion, brain fog for 1 to 2 days after. Common triggers. Sleep changes, too little or too much. Skipping meals. Stress. Weather changes. Certain foods, chocolate, cheese, red wine, caffeine. Strong odors. Perfume, smoke. Each person has unique triggers. Keeping a headache diary helps identify them. When to seek medical help? Go to the doctor if, first ever, unusually severe headache. With weakness, speech difficulty, possible stroke. With fever, stiff neck, projectile vomiting, possible meningitis. Increasing in frequency or severity. Medical treatment. 2 main approaches: acute treatment, painkillers, paracetamol, NSAIDs, or triptans, best taken early. Preventive treatment, for frequent attacks, over 4 per month, using beta blockers, low-dose antidepressants, anti-seizure medications. Also helpful, physical therapy, acupuncture, relaxation therapy. Caution: avoid overusing painkillers, this may cause medication overuse headache. Lifestyle changes, the deciding factor. Many patients improved simply by adjusting habits, regular, adequate sleep. Consistent meals, avoid skipping. Light exercise, yoga, meditation, walking. Stress management, keeping a headache diary. Natural supportive therapies, gentle massage of temples and neck. Cold compress on forehead during attacks. Deep breathing, mindfulness meditation. Hydration, avoiding alcohol and excess caffeine. Some herbal remedies, feverfew, butterbur, magnesium, vitamin B2, show benefit. I remember Ms. Lan, a 42-year-old teacher who had migraines for over 10 years. Her attacks came whenever exam grading loomed, stress and sleepless nights triggered them. After teaching her to keep a headache diary, adjust lifestyle, and practice yoga, her attacks reduced by half in 6 months. She told me, "Doctor, I realized it's not only medicine, but the way I live that decides whether migraines visit me or not." Final thoughts. Dear friends, tension headache is a common illness of our fast-paced world. It may not be deadly, but it quietly wears down our health and spirit. The most important weapon against it is not medication, but a balanced lifestyle, a calm mind, and respect for our own body. Migraine is a chronic neurological disorder, but not a life sentence. We can control it with knowledge, patience, and balanced living. If you live with migraine, remember, you are not alone. Millions worldwide share this journey. It is not hopeless, many treatments and preventions exist. Most importantly, listen to your body, and care for yourself with love and respect. If you suffer frequent headaches, give yourself time to rest, to breathe, to love yourself more. And don't forget, when unusual symptoms appear, seek medical advice promptly. May we all have lighter, more peaceful days, free from the shadows of headaches. Thank you for listening.